everyone, Dr. David here. I have been talking to a lot of patients today, recently, about knee pain. And some of the advice I've given, people have really liked. And so what I'm going to share with you today is 2 unexpected ways that you can help combat that knee pain. Now, a lot of times people feel that knee pain kind of right around the kneecaps, mostly in the front, kind of right underneath in that what's called patellofemoral tendon, or the patellar tendon, more simply. And so one thing we often try to do is stretch out, or kind of move our knee around. Doesn't really work too well. So another thing we can do is help kind of strengthen the muscles, the ligaments, and the joints kind of surrounding the knee. So something we don't really think about is there's actually the joint where the femur, the thigh bone, and then the 2 bottom bones articulate or kind of make a joint. So there's actually kind of 3 joints in that knee joint space, if we don't include the patella, which makes another joint, or kind of a joint, an articulation, if you will. So one thing we can do to kind of help combat that knee pain is actually strengthen the muscles in the front of the shins. So what we can do for that is kind of just lean back against a wall. It doesn't have to be a full wall sit. We just want to get our heels away from the wall, low back as close to the wall as we can so we're nice and supported. And what we're going to do is we're going to lift our toes towards our knees. So what that's going to look like is just kind of bringing the toes up, not trying to straighten out the leg, but just kind of slight knee bend, pulling those toes up. And so what that's going to do is that's going to strengthen the muscle right in here called the Tibialis Anterior. Tibialis Anterior is responsible for bringing the foot up so that when we take a step, our foot's not just flopping. It also kind of helps balance out the calf muscle, which does a lot of the pushing off during walking. So again, that's going to kind of look like heels into the ground, bringing those toes up, maybe hold it for a second, back down, nice controlled movement. Maybe do 3 sets of 5 to 10 reps. You can kind of listen to your body, kind of feel where that's at. So just try that out if you're feeling pain kind of around the knee. Another thing you can do is if you have access to a treadmill or even if you have access to kind of a hill, is walk backwards at an incline. So that's gonna look like here. Let's see if we can get this going here. So on a treadmill, we're going to turn up that incline, so it's like we're going to be walking uphill a little bit. Doesn't have to be super steep, but enough that it's a noticeable incline. It doesn't have to be super fast, but if you're walking backwards, which is what I'm going to recommend, you want to make sure that you're holding on, right? And so we're focusing on really kind of pushing through that heel. It's the same kind of thing as the exercise we were doing over there, right? So we're kind of using that tibialis anterior to kind of bring that foot back, making sure it's not flopping, all right? And you can also walk uphill like that, right? So if you're walking uphill, you kind of have to bring your leg up a little bit higher and really kind of push through hamstrings, quads, and get that tibialis anterior working to kind of bring that foot up so it doesn't just kind of flop into the hill, right? So, more or less, what we're working on is strengthening that tibialis anterior to kind of help balance out the knee, since a lot of the things we do with the knee is focused around the calf, hamstrings, and quads. So, if you like that, try it out. Let us know how it feels. If there's anything that you like to do to kind of help with your knee pain, exercise-wise, movement-wise, let us know. And I look forward to seeing y'all soon. Have a good one. Stay inspired.